Scribble.
Why do Americans skip ambulances? Do Americans actually avoid calling an ambulance due to financial concern? Yes, I'm a firefighter and EMT. We have a stretch of interstate and a 4-lane expressway in our response area. This past Sunday, we had multiple crashes when weather turned to shit. One crash, a head-on, had 4 victims. One was a young kid with a head wound, not in a car seat, and another was his mother with a broken leg. The father asked if the kid was well enough to just go home with him and he'd take him to urgent care. The kid was bleeding from his head and the father still wanted to refuse treatment. The cops on scene had to threaten to charge him with child endangerment if he didn't let the kid get transported. The father then tried to refuse medical treatment for his wife, but she was unconscious, so was unable to refuse. He cannot refuse for her. She had a broken femur and head injury, so it would have been really bad had she been able to refuse treatment. They lost their health insurance last month when he was laid off in October. Luckily, I guess, the crash was not their fault and the other driver is insured. I see a lot of incidents where people refuse medical care because of costs. When I was 21, I had a 106 fever for multiple days. Urgent care gave me fever reducer and told me if it still doesn't go away, go to hospital. It didn't go away. My mom takes me to hospital. We're in the waiting room for 3 hours and they basically are like, we have other people with more serious injuries. All you have is a fever. You'll be fine. After 5-ish hours, we left and went to the children's hospital across the street. I was borderline hallucinating and needed to be seen. They got me in way quicker and ran all these tests, but couldn't fully admit me because I was 21. Their tests came back and it was basically you could have cancer of some sort or blood poisoning. Some marker was super high, which is an indicator for cancer IDK. They contacted the other hospital and asked them to admit me, and they literally said the only way we'll admit her is if she is serious enough to come by ambulance. So they loaded me up into the ambulance and drove me across the street. Literally 2-min drive. They admitted me, I had blood poisoning and was hospitalized for 10 days. Blood poisoning can be pretty serious, got a bill for the ambulance for $3,000. 3-min drive, didn't need an ambulance, but it was the only way to get seen by the hospital. I'm still mad as fuck about it. In the US, if you can avoid it, never call an ambulance. Our healthcare is a joke. 9 months ago, my wife had a stroke, fortunately a minor one, but any stroke is not good. We drove 20 minutes to the hospital for 2 reasons. Expense and because the ambulance would have taken us to the nearest hospital, not the one with the best care, and we're both well employed with good insurance. In 1993, I was in a motorcycle accident, hit by a delivery truck, knocked unconscious, and my knee fucked up pretty badly. I woke up with the uniformed driver standing over me going, "Don't move, the ambulance is coming." I said, "Fuck you, I have to get to class," and started getting up, then realized that my kneecap was on the ground next to me. I sat and stared at it for a second, and then I said, "Ambulances are expensive, can you just, I don't know, drive me to the hospital?" 30 years later, things are worse now. Yes, I describe myself as middle class, and an ambulance ride would 100% be a huge financial setback. Unless someone is actively having a heart attack or something that serious, we would try to drive them ourselves, even calling friends to help move someone into the car if needed. My mother recently got swarmed by wasps when she unintentionally pulled up weeds at the entrance to their nest in the ground. She is in a wheelchair and fled into the house while being stung dozens of times, then called an ambulance. Because she wasn't having breathing difficulties, they didn't send a medic and were not equipped with an EpiPen. They wouldn't come near her with the still angry wasps around. She had to figure out how to get her wheelchair to them. They transferred her to a stretcher, almost dropping her in the process. The bill was $2,100 for a one-way trip to a local hospital. Yes, once on a family trip in Amsterdam, my dad bonked his head pretty bad, and when I brought up calling ambulance, he freaked out saying no way. Well, too bad, it was worrisome for me. So I called one. They came and had diagnosis devices in the ambulance to first determine if a trip was truly necessary. After confirming it was, my dad started giving me all forms of identification so they couldn't potentially trace the bills back to him. Well, I got to ride in the ambulance, who to this day I think of as the Dutch Batman. We rose to hospital together. Using no sirens was interesting. After some doc visit and a few tests, they cleared him to go. I asked them, what's the damage? And the receptionist looked at me funny. There is none. Would you like us to call you a taxi to get home? I knew about the good healthcare, but it was pretty mind-blowing to actually experience it. Often an uncomplicated ambulance ride can cost over $2,500. If your insurance does cover it, it may be through a complicated and time-sensitive reimbursement process. If your ambulance was provided by your municipality, the waiver process is even more complicated and they go to collections fast. In short, in America, ambulances are for the absolutely penniless and the comfortably wealthy. It's worth mentioning that a number of ambulance services, both ground and helicopter, have been bought up by private equity. Private equity does everything it can to squeeze as much profit out of everything that it touches. This means paying ambulance workers as little as possible and charging ambulance customers as much as possible. And since you're having a medical emergency, they know you'll put up with paying lots of money. If you're not having a medical emergency and think you'll survive without an ambulance, many people make the choice to avoid the crazy high fees of ambulances. It's almost like laissez-faire capitalism works terribly in some cases and allows greedy businessmen to squeeze money out of the rest of society. Isn't that what healthcare insurance is for? Insurance in the US generally doesn't pay the full amount of a medical bill. Health insurance has a deductible amount and also usually pays only a portion of the bill. Right now, there's a lot of Heath insurance plans that'll cost you $500, $600 per month, about $6 to $7K per year, which have a $10K deductible and pay 80%. In other words, if you end up with a $15K in medical bills for the year, you pay the first $10K and then you pay 20% on the other $5K. This adds up to a $11K bill for you. There are special rules for things like ambulances and ER, which I'm not accounting for. Basically, the US healthcare system is infected by greedy businessmen, and these greedy businessmen, along with their right-wing allies, have been doing a long-term push to label anyone who wants socialized healthcare as a socialist/communist and fearmongers about government death panels who will decide if you live or die. So we're stuck with corporate death panels instead. Oh, and medical bills are the #1 cause of bankruptcy in the US. Yes. From personal experience, the emergency room called an air ambulance to transfer me, and our first thought was, oh God, how much is this going to cost? And not, oh God, this pregnancy has gone completely off the rails, will baby and I be okay? And frankly, that's super fucked. I woke up the other morning with chest pains. I have a family history of heart attacks. I was scared. I went into the bathroom away from my family, sat down, and hoped they'd pass. If I died, my family would have enough money coming to them, they could pay off all debts, and live off my wife's very small salary forever. If I called an ambulance, went to the ER, got tested, and it was nothing, we'd be in debt for 5 years paying that off. I literally sat there weighing the pros and cons of calling for help or dying. I chose dying rather than making them suffer. Then it passed. Then I did go get checked out about 10 days later by a doctor because if it's non-emergency, our INS covers nearly all of it. It was nothing. But still, yeah, this country is fucked. Not just ambulances, we will delay or skip critical health care because we can't afford it. My neighbor died because he couldn't afford his blood pressure pills. But it's cool, we have to sacrifice so that our Lord billionaires can have private space programs. I work for a minor European health insurance that has around 4 million customers. We have a special department that deals specifically with American healthcare providers in case our customers go on holiday and need care. The department will handle contact with the providers and negotiate with them about the invoice. We do not have this for any other country. To say that the Americans have lost the plot is quite the understatement. Yes, I have done so myself, survived the emergency on my own, but was informed that my condition had been potentially fatal and not being transported to the ER was a big mistake. If it happened again today, I'd probably do the same. At least if I died, worrying about bankruptcy and homelessness wouldn't be a concern. Want more stories like this? Subscribe and stay tuned.